This week, the Centers for Disease Control and Prevention changed its childhood vaccine schedule. Now, routine vaccinations against 6 diseases will no longer be recommended under the new guidelines, and healthcare providers are reacting. 13 on your side's Peter Elliott spoke with one West Michigan provider. He joins us now with more on what they had to say. Peter.
Lauren, this is a major change to the vaccine schedule, which had been developed over decades. For healthy children, the CDC is no longer recommending 6 vaccines against diseases that can be serious, even deadly. They are hepatitis A, hepatitis B, influenza, meningitis, RSV, and rotavirus. The new guidance also splits the vaccines into 3 categories, one for all children, one for high-risk children, and one based on guidance from a doctor. The move from the CDC follows a directive from President Trump to review the vaccine schedule. Department of Health and Human Services Secretary Robert F. Kennedy says the change aligns the U.S. with international consensus. This new schedule is similar to that of Denmark's, but the American Academy of Pediatrics has objected to the changes and is continuing to urge parents to seek out the previously recommended shots. One local healthcare provider is also speaking out against the change. Bronson Healthcare, which serves Southwest Michigan and Northern Indiana, says it will continue to follow the guidelines of the Academy as well as the Michigan Department of Health and Human Services. Gregory Tiongson is the medical director for the Bronson Children's Hospital in Kalamazoo. He says the CDC's decision was made without any new data or scientific consensus.
Undisciplined and somewhat uninformed decision-making from folks at the CDC based on what seems to be an uninformed and an ignorant approach to public health. That's not based on science, not based on the evidence, and certainly not based on decades and decades of clinical experience and experimental evidence.
In a statement, the Bronson healthcare system also adding, quote, moving away from these standards risks confusion at a time when vaccination rates are declining and preventable outbreaks are increasing, end quote. The CDC's changes come amid a startling rise in cases of measles, the U.S. recording its highest number of cases in more than 30 years. We will have more reaction tonight from Dr. Tiongson later at 11 o'clock, including what he would say to a parent concerned about vaccinating their child. For now, in the newsroom, I'm Peter Elliott, 13 on your side.